Effective management of Ebola requires daily monitoring for a period of 3 weeks of all those coming into contact with an infected person, isolating and treating patients immediately, ensuring safe funeral and cremation practices to prevent the spread of infection, and trained staff must be on hand in the places where they are most needed. As the situation evolves, the international community must be able to react quickly and adjust their operations accordingly.
Even when we do manage to contain the outbreak somewhere, it doesn't mean the battle's won. What we need today is the flexibility to be able to redirect resources to areas where there are new outbreaks.
For example, the number of cases in Liberian capital Monrovia is dropping, so the capacity of its treatment centres currently exceeds requirements. Now the most urgent is to restore health services, in spite of the virus, and ensure that it doesn't break out elsewhere. Raising awareness among communities is absolutely vital in the other regions of West Africa where the epidemic continues to spread. Containing the Ebola epidemic demands resources that the countries concerned quite simply cannot provide alone. Many people fleeing violence in Iraq go to Kirkuk in the north. Half-built buildings become home to whole families who have been forced to leave everything behind. Here they are safe, but they receive almost no humanitarian aid.
No one has come to see us. No UN agency or anything. Just the governor of Kirkuk and the Red Crescent. No one else. We've made requests asking for help, mattresses, for stoves, oil and such like carpets. No one has given us anything.
This woman is being treated in a clinic set up by MSF. She has a brain tumour and needs a special diet for high blood pressure. But she has no money, and hers is not an isolated case. The medical teams witness the harsh living conditions the people are subjected to. Overcrowded shelters, sanitation not fit for purpose, and insufficient food. Conditions causing large numbers of people to contract respiratory, urine or skin infections or to become anemic. International aid efforts are focused on Iraqi Kurdistan, while Kirkuk, on the other side of the border that has seen no fighting and remains accessible to aid organisations, has become a city abandoned to its fate. Sangahis, UFOR, MISCA, MINUSCA. International military forces have been deployed in Central African Republic for months now, and while they have to some extent managed to contain the mass violence, they haven't been able to help the country to return to normal. MSF is witnessing the dire reality, particularly from the security and humanitarian perspective. While the violence is indeed more sporadic, it still exists, and crime is rife.
What's really striking in the Central African Republic is the impression of despair. A huge amount of humanitarian aid has been delivered, and although the MINUSCA operation is not the first peacekeeping mission to be deployed, the atrocities continue. The country feels like a gigantic camp where people are constantly intimidated by various armed groups and struggle just to survive.
People live in a state of terror. Bongi faced yet more waves of violence in August and October, and getting around the city was dangerous for MSF's teams. The city's inhabitants, patients, children suffering from malaria and the wounded were almost totally deprived of medical care. The return to calm is fragile, and the whole country is on the brink of violence. The insecurity also affects MSF staff and other aid workers, who in the past few months have seen an increase in minor and more serious incidents and hinders the delivery of humanitarian aid. Until May 2014, the hospital in East Cameroon's Buturi district didn't have the resources to treat the many people arriving from Central African Republic suffering from malnutrition. Last spring, MSF opened a therapeutic nutritional centre that has over 100 beds.
There are refugees everywhere. They've walked miles and miles without proper food. They've been cut off from their livelihood, which allowed them to survive. So when they manage to get to one of the camps, their health and nutritional status is often really very poor.
In addition to delivering the routine treatment for malnutrition and the complications it can cause, the MSF team provides psychosocial support to young patients and their families, as they have seen that this helps malnourished patients to recover. This support includes educating the people accompanying the children and encouraging them to stroke, massage and play with them. The team is also available to anyone wanting individual psychological consultations.